What paperwork should caregivers have ready for in an emergency? When the ambulance arrives or the doctor calls, are you going to be scrambling for health records, power of attorney, insurance cards? This isn't a distant someday issue. Emergencies happen, and when they do you want your paperwork at your fingertips or lost in a drawer? In this video, I'm going to guide you through a solid list of documents that every caregiver must have ready for an emergency. You're going to learn how to organize them, where to keep them, and how to make sure someone else can find them if you're not able to. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, and founder of LifeCare LeadHership. Over my years working with families, I've seen how being prepared, not perfect, but prepared can make all the difference when crisis hits. I created this podcast, The Age of Caregiving, to give caregivers like you the tools, structure, and support to lead care with clarity. Whether you're navigating a new diagnosis or you're juggling care on top of everything else, you're not alone. Please remember, everything I share here is for educational purposes only. Always consult your healthcare provider for any personal medical advice. If you haven't already, grab my Care Needs Analysis free training. It helps you see where your biggest care risks are and which documents matter most in your situation. The link is below. Let's talk about why emergency paperwork is more than just insurance cards. When you're in crisis mode, clear paperwork is more than convenience. It's your lifeline. Missing or outdated documents can cost time, energy, and increased risk. Your intention here is not to live in fear. It's to create clarity so that you can lead during these high stress situations. Here's some essential documents that you need to have: the medication list and a medical summary, a current list with the name of each medication they're taking, the dose, why they're taking it, how often they're taking it, who prescribed it, as well as any major medical issues should be on the medical summary. So major diagnoses and major surgeries they've had, who their doctors are, what their allergies are, that should be on the paper. Another thing to include are the contacts and caregiver lists. So names and phone number of family members, people who are able to make decisions, backup contacts, doctors who are involved in their care, those should be included on that list. You also want to make sure that the insurance card, ID cards are easy to access. Health insurance, Medicare, Medicaid, vision, dental include policy numbers and coverage details. Keep track of any information, any cards that might be expiring so that you make sure to renew them on the appropriate timeline. The fourth document that you need to have is the advance directive or living will. These are clear instructions that your loved one prepares for what happens if they're not able to speak and we're getting to end of life decision. These are documents that your loved one prepares to help guide you in the event the doctors think that they don't have a lot more time. How do they want to be cared for? Where do they want to be cared for? How much hospital and healthcare interventions do they wish for? Or do they not wish for those things? These are really important documents for your loved one to have prepared, and that you know where it is and you're able to find them if and when that time comes. The fifth document is a power of attorney document. This is a certified legal document that designates you or another person as the decision maker. There are medical power of attorney documents. There are financial power of attorney documents. Multiple copies of these documents are recommended so that the person who is the power of attorney has a copy, and there's a copy also near where that person lives so that if you ever need to find it, you know where it is. If you have copies of recent lab work, blood work, imaging, EKG scans, CAT scans, important copies of consultations, oncology consultations, cardiology consultations, if you have those, keep them with you, especially if your doctors go to one healthcare system, but the local ER is a different healthcare system. Sometimes they don't always have access to the information that you need, but if you have copies with you, you can bring it with you. I recommend that you have backup digital copies of all of these documents. You scan them and you store them securely in a place that you can easily access them if you're not at home. Here's where I recommend that you store it. You have it in a grab and go folder that's in the home. You can keep it near the medications or in a secure place that you know where to find it in case of an emergency. Make sure you have clear labels and you have a place that you know that if there are things that you have to update periodically, that you have a system in place to go and do so. Especially important if you're going to update it with recent labs or other notes. Make sure that at least 1 or 2 other people in your family know where that folder is and how to access it, and set a monthly reminder to glance through and update it periodically. This is especially important if there's any hospitalizations, any changes to their med list, any major changes to your loved one's health. If you're in a medical visit, make sure that you bring it with you so that if there's a question, oh, do you have the POA paperwork? Do you have the advance directive? You have it ready with you. Very important to bring it with you when you go to the hospital. If they need a copy, ask them to make a copy and give it back to you. Don't let them keep the original, all right? So make sure that you always have the original with you. Let them take a copy if they need to. If you found this video to be helpful and you are still trying to figure out how much help you need or what type of supports you need, I encourage you to watch my free training, the Care Needs Analysis Training, and discover exactly what kind of support would make the biggest difference, how many hours, what type of help, and where to find it. You'll find the link below. Remember, you're doing the work that nobody sees. You're organizing, you're updating, you're anticipating what could go wrong, and you're making plans ahead of time. That's a lot. But when emergencies come, and they will, knowing that your paperwork is ready gives you some breathing room. You're not going to be showing up as a frantic caregiver, but as a calm, composed leader. And that can change the outcome. Remember, you are more than just a giver of care. You are a leader of care. This is the Age of Caregiving, and together, we can lead it with calm, clarity, and compassion.